Elizabeth Mutuku there from Azerbaijan. Thank you so very much for filing that particular report. Back home, concerns mounting over the future of Kenya's public health system. Stakeholders now warn of a looming workforce crisis. At a national public health summit in Naivasha, experts and practitioners are calling on the Ministry of Health to urgently recruit public health officers and technicians, noting that the last major recruitment was conducted over a decade ago, with many current officers now earning retirement. Our reporter Willie Dennis.
Delegates at the National Public Health Summit have called for urgent reforms to prevent potential disruption of critical health services, warning that the system is under significant strain and requires immediate intervention.
We want to see the Minister of Health replacing or rather recruiting public health officers and technicians, because since the last time they employed the PHOs at the ministry was since before even the devolution it became in place. We actually seeing the next 2 or 3 years going forward, we're actually going to have an empty shell at the Ministry of Health.
Stakeholders announced a plan to present a comprehensive memorandum to the Ministry of Health outlining actionable steps to revamp the sector, address key concerns raised during the summit.
We shall not allow any public health officer to practice without a practicing license. That is the message that we are passing here.
Participants emphasized the need to strengthen core pillars of public health: detection, prevention, protection, and promotion, stressing that these are essential to safeguarding communities against both emerging and existing health threats.
We have seen a lot of issues like programs like school health, TB being manned by people on non-PHOs. We are not saying anything but raising an alarm. And you know this one goes down to service delivery. Because when we're talking about a school health program being manned by a non-PHO, it therefore means that we might not be able to experience a service delivery that's we're actually looking at.
Concerns were also raised over policy formulation processes, with stakeholders criticizing what they described as top-down approach. They argued many policies are developed at headquarters without sufficient consultation with professional associations on the ground.
Currently, the Ministry of Health is implementing very robust health sector reforms, and we don't want to leave anyone behind. We already have the memorandum from the union with all the issues that have been raised here.
Additionally, the summit highlighted gaps in school health policies, further underscoring the need for more inclusive and participatory decision-making as pressures mount on the government to prioritize reforms.
What is coming out prominently is not public health. And yet public health has a lot of responsibility when it comes to school health.
For TV 47, I'm Willie Dennis Njero.